Good afternoon. I'm Dr. Bonnie Henry, the Provincial Health Officer for British Columbia, and this is our update for April 18th on the COVID-19 situation here in BC. I want to first gratefully acknowledge that I'm speaking to you from the traditional and unceded territories of the Lekwungen-speaking people, particularly the Squamish, the Songhees and Esquimalt First Nations here in Victoria, and we're grateful for being able to do our work on this land. So for today, we have 29 new test positive cases here in British Columbia, bringing our total to 1,647 people who have tested positive for the virus here in BC. That includes 686 people in the Vancouver Coastal Health Region, 680 in the Fraser Health Region, 97 people on Vancouver Island Health, 150 in the Interior Health Region, and 34 in the Northern Health Region. We have ongoing 20 long-term care or assisted living facility outbreaks and one outbreak in acute care area. There are no new long-term care facility or assisted living outbreaks. However, we do have some new cases in that area, bringing our total up to 288 people who have been affected in the long-term care assisted living area. In addition, we have ongoing outbreaks, as you're aware, at correctional facilities, including the Mission Federal Correctional Facility, where we are now up to 70 people who have been affected by COVID-19, including 60 inmates. There are no new cases, and active support and outbreak investigation continues at the Okanagan Corrections Facility and the agricultural area in the Interior Health. Of our cases, 115 are hospitalized, and of those, 54 are in critical care ICU. Unfortunately, in the past day, we've had 3 more people who have died from COVID-19, all of them in long-term care, bringing our total up to 81. And as we reflect on the tragedy that has been our outbreaks in long-term care, we again send our condolences, and our heart goes out to those people who, their families, the caregivers, and the communities from these people. We have 987 people who are now considered fully recovered from COVID-19. As you know, yesterday we presented our latest modeling information and the latest numbers and some of the epidemiologic information so that everybody is aware of where we are in BC and how we're progressing through this pandemic, our pandemic here in British Columbia. This information, including all of the slides that we presented yesterday and the details, are available on the BC CDC website. In addition, the BC CDC has a new interactive dashboard that allows you to get ongoing real-time information that's posted online, and you can look at that and interrogate that by different areas and different aspects of the pandemic. And I hope people will go to that and have a good look, and it will help answer a lot of the questions that we aren't able to give you in details during our media briefings. There's also a new search bot, which is something new to me, but I understand now that it can help us get the latest information. It's on the BC CDC website, so you can type in your questions and get direct access to the information that you need on that website. This is all, of course, part of our commitment to the people of British Columbia to be transparent and to share as much information as we can, so you know exactly how we are doing together as we're moving through this pandemic. The modeling, as we talked about yesterday, shows us how we have done in the past few weeks, particularly since we put in place some of these incredibly restrictive measures here in our communities across the province. And it also gives us an idea of where we are now in terms of our pandemic and where we may be going in the coming weeks. And it also gave us some ideas of when and where we may be looking at lifting the restrictions and orders that we have in place now. And we've been trying to think of, how do we describe where we are right now? We really are in a hurricane, in a storm. But we have made considerable progress in our province, and it is because of what everybody has done together. We have listened to the orders and the restrictions that we've put in place. People have shown their compassion to each other, their kindness, and their commitment to protecting our loved ones, protecting our seniors and elders as best that we can, and protecting our healthcare workers and our health system so that it's available for all of us when we need it. We're also protecting our own families and our own communities by doing the things that we have asked you to do. And again, the very basic things that we've been talking about from the very beginning continue to be the most important. Washing our hands frequently, not touching our face and eyes, covering our cough, staying away from others, particularly if you have any symptoms at all, staying home, staying away from others, and importantly right now, continuing to keep a safe distance from people so that we can continue to not only bend this curve, but make sure that we're not transmitting this virus, that we can stop those chains of transmission, and we can bring our numbers down to zero. We can't lose sight of the fact that we continue to have people who are affected by this. We continue to have outbreaks. We continue to have transmission. And so we are not at the point yet where we can let up our guard. The storm is still raging, and tragically we see that in the fact that people are still dying from this virus here in BC. The risk of a spike or another outbreak or more clusters in our community is something that's a very real concern for me, and we know it continues to happen. We know as well that we are subject to what's going on around us, and that has become really apparent. This is a global phenomenon, and we know that this is still a major problem in communities all around us. And there's been, Alberta, for example, has done many great things, very similar to what we've done in BC, but we're still seeing clusters there. And what happens here affects what's happening in Alberta and vice versa. We also know that there's ongoing challenges in other provinces of Canada, in Quebec and Ontario in particular, and what happens there affects us. So we need to make sure that we continue to take the measures that we need to do here in BC to protect our families and our communities. The easing of restrictions, when they come, will be gradual and will be slow and thoughtful. We took very quick action to get us into this, but we don't want all of the sacrifices that we have been doing across the province to be for naught. We need to make sure that when we open things up, we do it in a measured, thoughtful way that protects us and protects all of us while opening up our economy, while opening up our health system as we move forward. And we've talked a lot in the last few months about the fact that there's a long incubation period for this virus. People can be exposed and not be sick themselves for up to 14 days. So we have to think in 2-week increments. So what happened on the Easter weekend, for example, we're going to start seeing if there's impacts on our communities in the coming days. When we start to lift restrictions, we're going to be doing it gradually and thoughtfully, and we're going to be watching. And that watching period will be in 2-week periods, so that we make sure that we're not getting ahead of us and we don't start seeing rapid, explosive growth that we've seen in other places around the world and in Canada. So this thoughtful and careful approach will be taken, and if we continue to see sustained improvement in the next 2 weeks, and this is really critical, we look at the modeling and we show that we are still right in the, we're nearing maybe the end of our storm, but we're in that eye of the storm right now. We're not going to be taking any measures in the next 2 weeks, but we are planning. We are planning for what is going to look like when we get to that point in May, probably in the middle of May, where we are able to take those actions that help increase our social connections, increase our industrial and our business connections, and also increase opening up of our healthcare system. So the new normal will, however, be a modification of some of the things that we continue to need to do today. So things like cleaning our hands, covering our cough, staying home when we are ill, no matter how mild it may be, those things are going to continue. Our distancing and our safe distances between us are going to continue, and we need to look at how we can open our schools, open our businesses, but still maintain those safe distances between us. And that is what we'll be working on with you and for you in the next couple of weeks. What we need to do now is to hold our line. And please keep doing what you've been doing. Continue to show the kindness and care that we know is important for all of us to get through this together, and that you have been showing across BC. And do all you can to flatten our curve to zero. You are making a difference, and we are making a difference together. So we need to continue to be kind, to be calm, and to be safe. Thank you, and I'm happy to take questions.
Thank you. As a reminder to everybody on the phone, please press *1 to enter the queue. You are limited to one question. Also, please unmute your phones. You will not be audible until I call your name. First question today is from Richard Zisman, Global News.
Dr. Bonnie Henry, I've heard a number of things since yesterday from people trying to figure out plans for the summer around weddings, around celebrations. Obviously, there's large-scale events that are planned for the summer that take a lot of advanced work. What is your recommendation first for the larger-scale events like the PNE or for the Pride Parade or any of these big events? What's your advice to them, and what's your advice to individuals that have summer weddings planned? Should they be canceling? Should they be postponing?
Yeah, those are very good questions. And realistically, we will not be having those big events where people gather together this summer. This is going to be, that is a much riskier prospect than ever before. We do not have enough herd immunity or community immunity to protect everybody and allow that type of event happen. So I think we'll be seeing globally those types of events, large parades, large mass gatherings where we all come together. Those will not be happening this summer. So I think we can think about how we can celebrate important milestones, important things in our lives in a way that allows us to have a safe distance. And I think we should start planning that now. So things like the PNE are not likely to happen this year. You know, this is a challenging time around our world, and it's not going to be easy for us to get out of it, but we should, those types of large mass gatherings where we have lots of people together, this is not the time for that, and it's not going to be through this summer. It will be again in our future, and I think we have to keep hold of that the things that we're doing right now are not forever, but this is a very challenging time for all of us globally. In terms of those smaller events like weddings and family parties and anniversaries and graduations, again, you know, this is a very challenging time, and I know it's really hard for people to think about having these events without getting together, but we've found some really innovative ways of doing that. So I would tell people to think small. We're not going to be having large gatherings. We know that those are the types of events that this can be transmitted in, particularly funerals, those family celebrations when we spend time together, weddings and parties where we share food, where we hug, and when we care for each other in a very close way. Unfortunately, right now, those are the things that are risky. So I think we need to start thinking about planning small events, looking at how we can bring people together virtually, how we can support particularly our seniors and elders who are most at risk. Support them being involved without being physically together. And there's lots of great ways that people are starting to do that, and we need to think about how do we do that through the summer. I do think there is possibilities in the summer that we're going to have lots of opportunities to have more social interaction. But if we look at the modeling that we did, and we'll be presenting more of this, we need to find a sweet spot, a balancing of connection that allows us to be with close contacts and close families, but still protecting our healthcare system, protecting those who are more vulnerable to having severe illness with this virus. So it's going to be a modification for the next year.
Next question is from John Hernandez, CBC.
Hi, Dr. Henry. Just wondering, we're hearing about a positive case at the Fraser Valley Institute for Women. Wondering if you could potentially comment on that. And then just a second follow-up here. we are hearing a lot of cases just in long-term care homes, prisons. I'm just wondering, to what extent are the new cases we've been hearing about over the past number of days, are we seeing that from public spaces like grocery stores, parks, things like that? Or are we still generally seeing most of the cases kind of emerge at existing kind of outbreak centers?
Yeah, most of the cases are emerging in close contacts. So we're not seeing sort of those. We're not seeing transmission of the virus, nor have we anywhere in the world from very fleeting contact in outside or in places like grocery stores. For the most part, what we're seeing is people who have spent time together inside in a space together, in close contact with them. So if we look at the prison setting, for example, long-term care, we can see that. But many of the community cases as well are people who may have traveled, may have been exposed to someone, been exposed and not recognized that they were ill and passed it on to family and friends. That's where we're seeing across the board. It's mostly those close contacts that we're seeing. It's not something like being outside and being for a very short period of time next to somebody. So again, really important to continue to keep our safe distances, both inside and outside. And that's why it's so important right now as well to not have those gatherings where we're coming together and mixing, because we know that people can have very mild symptoms or be early on in their symptoms and may not even recognize that they have it. And we're doing some testing in some of the closed settings to see if we can identify people who might be infected and either at risk or of developing symptoms, and making sure they can be isolated and not passing them on to others.
Next question is from Ashley Wadwani, Black Press.
Hi, Doctor. Yesterday you spoke about two kinds of processes for herd immunity, through enough people contracting the virus and recovering, or from a vaccine. Some people have asked why BC, other provinces, other countries haven't essentially isolated the most vulnerable and then allowed those healthy enough to withstand the virus, allow the virus to essentially run its course. Can you explain why this wasn't and isn't the route being taken here, and maybe the implications that come from that kind of way of developing herd immunity?
Yeah, and there are some countries that had some thought about that early on, the UK being a case in point. The challenge is that when you have lots of people become ill with this type of a virus, even young healthy people will become sick, will need hospitalization, will need ICU care, and some of them will die. So it's not an effective way, and there's been experiments of this the UK is the most classic example, where they recognize that you can't isolate seniors entirely, for example, and that you can't always identify who is at most risk. So with a virus that is as infectious as this, that causes as much serious illness as this, we know that if we let it take its course, for example, without trying to do measures to prevent transmission, then you get explosive outbreaks, you get rapidly increasing numbers of people who get sick, and you get a number of them, many of them, who need hospital care and need ICU care, and it can overwhelm your healthcare system. And we've seen that in many places. Iran was a good start, places like the UK. So that is not a strategy that works for a virus that has such a high case fatality rate as this one.
Randy Adams, CJDC.
Hi, Dr. Bonnie Henry. Thank you for taking my question today. My question is, in terms of this new modeling outline you've presented, how could these conclusions be made if the testing being done here in BC isn't really comparable to other provinces? And are there plans to relax testing protocols?
And so the testing is absolutely comparable to other provinces, and I think this has been the challenge. People hear things about, oh, test everybody. That's not what the WHO meant when they said test, test, test. They meant, making sure that you were testing the people who were at risk so you could identify people early and isolate them. And our focus testing is aligned with the strategy that has been taken around the world, but also been taken across the country. We have opened opened up our testing. About last week, we started to do more broad testing in our community, and so anybody who has symptoms is tested or can be tested now. We were focusing our testing on people that we knew might end up in hospital, on clusters and outbreaks, and testing around those cases that we found in our community. We are now broadening it, as we said we would, when you reach a certain phase in the pandemic. So our numbers are absolutely comparable. As I've also said, we won't know the total number of people who have been infected with this virus until we have a good test that allows us to look at how many people have antibodies, which is a sign that your body has been infected and has responded to the virus. And an antibody test is in our future. There's lots of work being done on it right now at our BC CDC lab, and we have a strategy for how we're going to look at that. And there's been some tests done, some studies done, one recently in California, for example, that showed an increased proportion of the population had been exposed than the people who were tested with the nucleic acid testing that we're doing now. We'll be doing very similar studies in the future. I will also say that, we've never stopped doing what we call surveillance. So any swab that was submitted to the laboratory here in BC for influenza, for any other respiratory virus, was automatically tested for COVID, and that continues and has continued all along. And that's one of the ways that we know it gives us a measure of what's happening in our community.
Next question is from Bethlehem Miriam, News 1130. Go ahead.
Hi, Dr. Henry. Thanks for taking my question. As you discussed yesterday, it could be up to a year before international travel is allowed again. Along with masks, which are mandatory, what other measures should be in place to guarantee safe travel by air? And are people with fevers, will they be kept from boarding a plane as well?
Yeah, those are all very interesting, phenomenon. Yes, I think we now and we will in the future be much more sensitive to people flying when they're ill. And I think that's a good thing. We've said this from the very beginning, that people need to avoid travel, avoid going places if they're sick themselves. But many of us, we think, oh, well, it's just a little bit of a cold, we'll be okay. Yes, I realize Transport Canada has put in place a requirement to wear a non-medical mask, a cloth face mask, during transit right now. I think that's probably going to be in place for some time until we have a better understanding of what this virus is going to do in the future, or we have a way to protect people through things like immunization.
Melanie Nagy, CTV.
Dr. Henry, when we talk about the gradual lifting of restrictions and all the, how so much care and attention has to go into this, what do we say to businesses? We know there are so many that are anxious and desperate to reopen. We have store owners calling this, well, could I run my shoe store the way a grocery store is run by letting people in, or different ideas like this? What can we say to businesses, to give them a sense of when maybe they can start to be a part of the plans and look to reopen?
Yeah, that's a really good question. And what I would say is start thinking like that. Start thinking about how you can run your business with maintaining the physical distances that we need to keep between us. So yes, if you're a retailer who can operate in the same way as a grocery store is now, that's a great thing to start planning for, how you might do that. I would also suggest that people start planning for hybrids. How do I increase my online presence so that people can come by and pick up rather than coming in and spending time in my store? Those types of things, businesses should be thinking about, okay, if this is going to be our new normal for the next year, how can I continue my business with making sure that I'm protecting my staff? So maybe I break them up into teams, so not everybody is in the office at the same time, so that some people are working remotely, that I'm able to do my contacts with my customers in a way that allows us to keep our distance from each other. Then modifying how we do things when we go out into the community, and I'm thinking about, window washing, that you can do do it with notifying people ahead of time, paying online so that you don't have to make connections, that nobody can be there. So I think there's lots of things that we can do to gradually increase opening of our businesses with the understanding that we are going to have to take precautions over the next year, maybe longer. And that will be making sure I have hand hygiene available, making sure that if any of my staff are ill, that they are able to stay home and stay away, making sure that I have things in place that allow my employees to be physically distant from each other as well as from my customers. And how do I do virtual meetings? How do I have a hybrid of my online presence? So I think there's lots of things people should be thinking about now. And what we're doing in the ministry and across government is saying, okay, what is the guidance that we need to incorporate into each of our different types of business? And so we are working to provide that support to each of the ministries, and they are connecting with stakeholders with their stakeholders in the community. So those are the types of things that we'll be seeing more of in the coming weeks. As well, we're looking at what do we need to do in our health system to make sure that we have the ability to surge if we need to, if we reach a point where we start having transmission and we are able to pick it up quickly, we're able to test quickly, we're able to isolate people, but we're also able to make sure we protect part of our healthcare system to be able to manage a surge without stopping all of the other things that we did in our health system as well. So it's complicated, but those are the types of things that people should be thinking about now.
Next question, Vaughn Palmer, Vancouver Sun.
Good day, Dr. Henry. In explaining some of the restrictions brought in Germany, the Chancellor, Angela Merkel, did a broadcast where she talked about the consideration of the reproduction rate and how physical distancing could affect that. And I'm wondering, based on what you've seen with all the data here in British Columbia, do we have any sense yet of things like that, the mortality rate, the reproduction rate? Do we have any of that yet? And the other thing I wanted to ask you about, because you said the other day that British Columbia is not keeping track of potential cases the way it's been done in some other places. Has the province kept track of people who've been asked to self-isolate but never been tested? Because I think from what you said about the serology test, that might provide a pool of people to be tested to see if they have the antibodies.
Yeah, so to answer your last question first, yes, people who have been close contacts, and I don't believe I ever said we're not keeping track of people in the same way that others are. I think we are keeping track of people in the same way that most people are. Where we are not, where I don't always know is people who have traveled outside the country who we have said, there was a period of time, as you will recall, where there were lots of people coming back. And we had no way of knowing who they were because our borders were still relatively open. And what we said to them was, you are at risk, and if you have mild symptoms, you all need to self-isolate. You need to stay home, and you call 811. You let us know if you get sick enough that you need health care. So there's a group of people that we don't know that were people who traveled and may have develop symptoms. But yes, we do know people who were close contacts in a lot of the clusters, and we know that we have a broad understanding of our health care workers. So yes, those are all people that we will be targeting for serology testing when it's available. But we also have a research protocol that we have had in place for some time, where we've got a random sample of blood tests that people had of blood that from tests that people had. So it's all completely anonymous, but it allows us to understand by different age groups if there was people with this virus with the antibodies early on. So the blood is from prior to us seeing a lot of this this virus circulating in BC, and then we're going to get samples again. So we will do systematic sampling across the province to give us a sense of how many people have been infected with this. So that's part of the ongoing work that BC CDC is doing, that we've been supporting through the Michael Smith Foundation and through the Canadian Institute for Health Research. There's also a broader initiative across the country to look at how we can use antibody testing to get an understanding of how all of us have been affected across the country. And I think there was one other part of your question that I've forgotten, sorry.
We'll get back to that one.
Okay.
Wendy Stewart, Globe and Mail.
Oh, hi there, Dr. Henry. I was wondering if you could just talk a bit about schools, and you've talked about this measured and thoughtful way of easing restrictions. Yesterday you talked about 12 and 18 months. Today you talked about these 2-week increments for people with kids in school or not in school right now. Do you anticipate that students may not be able to return to their schools as before for as long as 18 months, or can you talk possibly about that scenario?
Yeah, so I think what I've said was that we would have modifications over the coming months. And yes, I do think that there is, I absolutely think we'll have some children back in school this year, maybe, but it may be modified. And I don't have the exact blueprint or answers yet. These are all of the things that the Ministry of Education, the superintendents are working out. Depending on the system, depending on the size of the school. So there may be different strategies in different parts of the province. But we will be looking at how do we best support all children in their learning needs, and also with a special focus on children who are at the most disadvantaged, to make sure that they don't fall farther behind. So those are the principles that we're talking about, making sure that we have appropriate childcare for those childcare and schooling for children of essential workers across the board, and scaling that up as best we can. But there may be certain groups where in-classroom learning is not necessarily the right answer. So I've not said that, and I absolutely do not think that kids will be off school, out of classrooms for the next 18 months. Absolutely not. I did not say that. What I said is what we need to do is, starting in May, looking at how we modify things and making sure that we're doing everything we can to support those children who are most disadvantaged and most need the in-classroom exposures and learning in schools. So it's a bit of a modification. I don't have the blueprint and the answers yet, but those are the things that people are thinking about, and will be able to give you better answers to once we reach that point where these are the options. So we're looking at middle of May, end of May. I will go back to the other question, which is one of my favorite things, talking about R naught. So the reproductive number, which Angela Merkel talked about. When we talked about that quite a bit, and the modeling helps us understand. And what R is, or the reproductive number, is how many people somebody transmit the virus to when they're infectious. And it's a combination of things. It's a combination of how long I'm infectious to others, how many people I come in contact with, whether I have symptoms, whether there's immunity in the community. So when we first look at the reproductive number, we call it 0 or not, because everybody is susceptible, and it's when the virus is first introduced into a community. And the modeling showed that when it was first introduced into Wuhan, for example, most people transmit it to 3 to 4 to as many as 6 other people. And that's why you get these massive explosive outbreaks. But then if you put in measures that keep sick people away from well people, essentially, then you can bring that down. And we know that if you get it under 1, which means for every person, they don't transmit they transmit to less than 1 other person, so you work it out on averages, then you can stop that an outbreak will die out. So what we've been doing, all of these measures about distancing, is what we call breaking those chains of transmission, bringing that reproductive number under 1, so that if I get sick with this virus, I'm isolated and I'm not going to pass it on to anybody else. So absolutely, we are looking at that, and that's one of the measures that we can use to help see if we're getting increased transmission in the community. It's one of those epidemiological indicators that we follow.
Rod Brown, Dawson Creek Mirror.
Good afternoon. How are you?
Thanks.
Just wanted to square your, I guess, middle of May timeline with your counterpart in Alberta, who's saying end of May. I say that because we're up here in the north, so close to the Alberta border. And as well, I just wanted a follow-up question about your literal Facebook cover from the province about your actions make a difference. Is that a real graphic of anything, or is that just an image?
I'm not sure what that's referring to. We can get back to you on that. I'll have somebody get back to you on that, so sorry about that. But yeah, no, let me just be clear again. When we say middle of May, that's best case scenario. That means that everything is going, that's what we're aiming to think about starting. It's not a hard date. I'm not saying, May 15th, this is what's going to happen, okay? What I'm saying is if things keep going the way they're going, because we are not out of this yet, and we saw that from the modeling yesterday, we still have a period of time. If we start to open up and increase our social activities and our connectiveness, and we start getting more outbreaks in our community, because it is still circulating in our communities right now in BC, we are not at the point where we can start opening up now, and we won't be for several weeks. What we need to see is our number of new cases per day going down to 0, and as you know, we're not there yet. So we need to, that's the first marker that we need to be watching for. And then we can start looking at very thoughtfully, slowly moving things. So I think absolutely sometime in May is what we're looking at, maybe, if things keep going the way they're going now. So that's how important it is that we don't stop doing what we're doing right now, because that will just delay our ability to start increasing and opening up. And we're pretty much the same as Alberta. As I was mentioning, our pandemics have followed very similar trajectories, and I think we'll be working very closely with Alberta, and I do talk with my counterparts in Alberta on a near daily basis. So yes, we're tracking very similar pandemics to what's happening in Alberta as well, and it's going to be very important for us. And as I mentioned, not just Alberta, but we have a lot of people who move back and forth for a variety of reasons between Ontario and Quebec, so what happens there matters to us too. So those are all very important considerations.
Carl Yu, Nanaimo News Bulletin.
Thanks for taking my call, Dr. Henry. There were reports a couple of weeks ago about, I believe, a positive test amongst an animal. I'm just wondering if you have a comment about how realistic pet owner transmission is, particularly with dogs.
Yeah, so there's a couple of case reports of dogs in Hong Kong, but it was human to dog transmission, and there doesn't seem to be a risk to humans from animals. They don't seem to get that sick with it, at least not dogs or cats. There was a tiger in the Bronx Zoo, I think, that tested positive as well. So we have been following this. There's been, and actually there's some information posted on the BC CDC website about that as well. Our public health vet has been following it. Does not seem to be a risk to humans from getting it from their pets, so it doesn't seem to go back and forth. Humans can transmit it to their companion animals, some companion animals that don't seem to be transmitted to birds, for example, and we've seen that as well. And there's been some testing of livestock to see if it goes between humans and livestock, and so far doesn't seem to be an issue there either. But there have been a few very small number of case reports with cats and animals, cats and dogs.
So we have time for one more question today. For any reporters that didn't get to ask a question, there will be a statement released later this afternoon. For any recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the Provincial Health Officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Colton Davies, Radio NL. Go ahead, Colton.
Hi, Dr. Henry. Thanks for taking my question. The Interior Health Authority today has warned people about an outbreak at an oil sands work camp in Fort McMurray. I'm curious, how worried are you of potential community spread from work camps, coming to different transmissions, coming to different parts of BC, potentially from work camps, either in BC or Alberta? And what measures can you reiterate, can you say are in place to prevent these kind of work camp outbreaks within the work camps that are in our province? Thank you.
Yeah, a very good question. And yes, we've been watching very carefully. We know that there's a lot of flow of essential workers across the border and workers in the oil sands in Alberta and in northern BC in particular. So we have quite detailed guidance and very similar to what they're using in Alberta for detecting people who may have this, for ensuring that there's precautions around isolating people, as well as plans for removing them if they need health care, as well as steps to minimize introduction into those, both into the camps, but also from camps into communities. And we do know that there have been some people who've returned home to British Columbia who were exposed potentially in Alberta and vice versa, and they are being monitored, self-isolating, being monitored by public health. So that is part of our whole way we need to approach this. We can't stop all movement in our province. We need to have essential work done, but we need to make sure that we have the things in place to do our best to prevent it. And again, it goes back to those basics that we need within a work setting, but also all of us individually, plus having public health to be able to do the case contact management for people who are coming back who may be at risk. So we are watching that and working with our colleagues in Alberta to make sure that we're all exchanging information and supporting people who might be at risk.
That's all the time we have. Thank you.
Thank you very much.